Thank you, Minister. Senator Leyonhjelm.
Thank you, Mr President. My question is to the Minister representing the Health Minister, Senator Nash. A friend of mine is trying to quit smoking, but after a while, without a cigarette, he gets terrible headaches. Pretty soon he's smoking again. He'd love to try e-cigarettes like he could if he was in Britain. Public Health England says they are 95% less harmful to health than cigarettes, but your poison standard doesn't allow e-cigarettes, even though it allows cigarettes. Can you explain this without relying on the story of the never-ending in-house review? And can you explain why companies that make nicotine patches are invited to the biennial meetings of the Framework Convention on Tobacco Control, but companies that make e-cigarettes don't?
The Minister for Regional Development, representing the Minister for Health, Senator Nash.
Thank you very much, Mr President, and I thank Senator Leyonhjelm for his question and some advance notice of it, and note his ongoing interest in this area. Mr President, the Senator is indeed correct that currently the e-cigarettes containing nicotine are not available for commercial sale in Australia. This is as a result of the current national and state and territory laws. The TGA Act, as I'm sure the Senator knows very well, and the associated regulations with that, do provide the national regulatory controls to ensure the timely availability of the therapeutic goods that have been assessed for quality, safety and efficacy to help people quit smoking. I can advise the chamber that e-cigarettes have yet to be approved through this process. So, as I understand it, the TGA is currently considering an application. I note the Senator's reference to ongoing review, but I think even he would understand that the TGA processes are there for a reason, to ensure the safety and efficacy of these products, of medicines and medical devices, and that application is currently before the TGA. And I think people across this country, Mr President, do expect a level of robustness when it comes to, again, determining that safety and efficacy of products such as these. In relation to the attendance of those companies involved with e-cigarettes at the framework, the invitations, I understand it, are a matter for the Secretariat of the FCTC.
Thank you, Minister. Supplementary question, Senator Leyonhjelm.
When my friend gets a headache, like millions of Australians, he finds headache tablets that include codeine are most effective. But he understands that moves are afoot to reschedule codeine as a prescription-only medicine under the poison standard. That means he'll need to get a prescription if he wants to continue taking tablets containing codeine for his headaches in future. Can you advise whether this is the case?
Minister.
Thank you, Mr President. The decisions made in relation to medicines such as codeine are not made by politicians, and I expect people across Australia are very happy that they aren't. They are made by experts, and they are made by those independent experts in relation to these types of areas. Now, my understanding is that the TGA has received many submissions in relation to this issue of codeine moving to prescription only, and that they have deferred a final decision on this while they are awaiting that further information, so that they consider it and, of course, take further advice in relation to this issue. The Pharmacy Guild of Australia, I understand, is involved in this process in providing information to the TGA when it comes to MedAssist, and I think it's very appropriate that those companies, those health professionals, are involved in advising the TGA in terms of this process.
Thank you, Minister. Senator Leyonhjelm, a final supplementary question.
When this friend of mine is suffering a headache, he finds an ice-cold can of Coca-Cola extremely refreshing. They're not a donor yet either. But there's a proposal to tax sugary drinks based on the silly idea that if my friend gets fat and ends up working less and paying less tax, then he's doing the rest of us a disservice. Can you confirm that this government will never introduce a sugar tax?
Minister.
Thank you very much, Mr President, and I'm sure that Senator Leyonhjelm's friend is...
Order, Minister. A point of order, Senator Dastiano.
Mr President, I think this is unparliamentary. Can the Senator please refer to his friend by his proper title, no, Senator Leyonhjelm?
There is no point of order. Senator Nash, you have the call.
Thank you very much, Mr. President. And unlike those opposite, I'm not going to make any assumptions about Senator Leyonhjelm's friend, but I do note that I'm sure his friend would be very happy that Senator Leyonhjelm is speaking on his behalf. Mr. President, I can indicate to the chamber that sugar tax is not government policy. On this side of the chamber, we absolutely believe that people need to be well informed when it comes to making their decisions about appropriate food and appropriate diet. That's why we put in place the Health Star rating system, which is incredibly successful in informing people, Mr. President, about making healthy food choices. Also the Healthy Food Partnership, which I'm pleased to say I was involved in setting up, Mr. President, to give better information to people. A sugar tax is not government policy. We certainly believe that people should take responsibility for their actions, take responsibility for eating in a healthy way, and we do not support a simplistic reaction to a complex problem.
Thank you, Minister.